I often work with athletes who are having trouble returning to their sport following an injury, possibly a knee or shoulder injury, maybe a concussion, and there are a number of issues that can delay their return. Sometimes it has to do specifically with the injury, but it may be anxiety or pressure that they're dealing with that they put on themselves to return to their sport. It may come from their teammates or from their coaches. This is extremely common, and if this is happening, you're not alone. There are resources available in your community and at your school to help you deal with these issues so that you can get back as quickly and as safely as possible.
As athletic trainers, oftentimes we are the first point of contact when student athletes, coaches, or teammates have mental health concerns. As athletic trainers, we have the knowledge and the resources to make appropriate referrals to healthcare professionals in both acute and chronic mental health situations. As athletic trainers, we spend countless hours with our athletes, forming those relationships, forming that trust. So it's always been my hope that my student athletes feel comfortable coming to me with both their physical injuries and their mental health injuries.
With us being the primary point of contact, our job then is to make sure that the student athlete is referred to the appropriate provider. We typically are the ones that are listening to any concerns that the student athlete has right off the bat, just because of how frequent our interactions are. But we're not the only one that's involved in the healthcare process for mental health care.
So people in the sports psychology field, sometimes it's called performance psychology, people in that area tend to focus on helping to teach skills that can help people perform the most consistently as possible at the highest level that they can. So a lot of the topics that would be covered in a sports psych consultation would be centered around things like dealing with motivation, pre-competitive anxiety issues, relaxation, imagery, goal setting, maybe dealing with mistakes. So that's really what a person who's in sports psychology does. Some people who are in sports psych also do have clinical or counseling degrees and are licensed in those areas. So they have a much larger scope of practice and can help with areas that deal with more clinical or counseling-based issues like generalized depression or anxiety or eating disorders. But sports psychology does tend to focus more on just the performance-based issues.
What we look for in daily functioning are changes in eating, changes in sleeping. You're not managing your time as effectively. You may not be as motivated to do things. You can't focus as well on your work or in practice. You feel like you're not performing well on the court or off the court. You may be isolating from your family and friends. Those might be all indicators that you might want to go see a counselor or somebody like me. When we meet, we first identify what's going on. We identify the triggers that have brought you into the therapy session, and then we work on managing some techniques to help you with the issue. Sometimes you might meet once a week with your therapist or bi-weekly, and in between sessions, I probably will give you some homework. The most common issues that I treat in the counseling center are depression, anxiety, with some eating disorders, substance abuse issues, recovering from sports injuries, again, stress, maybe something going on in your family life. Your parents might be getting a divorce and it's affecting you. Maybe you're having some relationship issues. Those are all things you could come in and talk to a counselor. Also, reaching out for help is not a sign of weakness. It is a strength. It is a sign of awareness that you're struggling with something and you're willing to work on it and try to manage it and then move on with life as it presents itself.
So my role here centers on providing both mental health support as well as occasional help with performance-related issues. So we do everything from time and stress management, relationship issues, drug and alcohol problems, depression, anxiety, bipolar disorder. You name it, there's a pretty good chance that we work with athletes on it. We provide individual counseling. We will provide some group counseling if it's requested. Drug and alcohol, assessment, for students who may test positive. And we also do teamwork if it's requested. When it comes to working with athletes, let me just start off by saying that everything is confidential. Information is not released to friends, family, professors, employers, coaches, etc. And sometimes for student athletes, the concern is that athletic culture doesn't always allow for people to be vulnerable or to talk openly about anxiety or depression or other issues. So when students come into our office, we try to provide a safe space for them to be able to address those concerns. In some occasions, students are coming in and they're dealing with pressures from family, from coaches. There may be pressures about their sport, maybe pressures about school or academics or relationships, and just helping them to put things in perspective and to talk through and work through some of those concerns so that they feel like they're getting an individualized experience.
The role of a primary care provider in mental health can be twofold. One, we may have access to the student athletes when they are doing screening or coming in for pre-participation physicals and may pick up on some mental health issues at that time. Or maybe we're seeing them post-injury and same thing, picking up on some symptoms that they may be having. The other role of a primary care provider is to provide medication if that is needed. So in working with their counselor and the student athlete, we find that medication may be the most helpful. Primary care providers can write medication for depression, anxiety, attention, sleep, panic attacks, any of those kinds of issues may be helped with some medication that we have available.